Based on the current evidence, we propose two novel research questions. Firstly, does the home-based high-intensity inspired muscle training program increase peak oxygen consumption from baseline more than that in sham controls in patients with heart failure with mildly reduced and preserved ejection fraction? And the second question is the home-based high-intensity inspired muscle training program safe? And does it improve maximal inspired pressure, 6-minute walking distance, quality of life, and echocardiographic diastolic parameters? So we conduct this study with two objectives. The primary objective is to evaluate the effect of the home-based high-intensity inspired muscle training program on an increase in peak oxygen consumption from baseline in patients with heart failure with mildly reduced and preserved ejection fraction compared to sham controls. And the secondary objectives are to evaluate the safety and the effects of the home-based high-intensity inspired muscle training program on improvements of maximal inspiratory pressure, 6-minute walking distance, quality of life, and echocardiographic diastolic parameters. And we hypothesize that the home-based high-intensity inspired muscle training program increased peak oxygen consumption from baseline more than that in sham controls in patients with heart failure with mildly reduced and preserved ejection fraction. And it also is safe and it improves maximal inspiratory pressure, 6-minute walking distance, quality of life, and echocardiographic diastolic parameters from baseline more than those in sham controls in patients with heart failure with mildly reduced and preserved ejection fraction. This is my conceptual framework. Patients with heart failure with mildly reduced and preserved ejection fraction will present with inspired muscle weakness, and inspired muscle training will help to improve the strength, speed of shortening, power output, and endurance of inspired muscle. By that way, inspired muscle training could improve peak oxygen consumption and other outcomes. I have just explained the reason why I look forward to conducting this research. Now I will proceed with clarifying the method for undertaking it. Firstly, the study design. We use randomized control trial design. The patients who was diagnosed with heart failure with mildly reduced and preserved ejection fraction in the medical records in heart failure and heart ablation clinic of the King Chulalongkorn Memorial Hospital. We will assess for eligibility, and they will be excluded if they meet exclusion criteria. Then they will be randomized to two groups, high intensity IMT and some IMT group. This eligible criteria, I will include the patients with diagnosis of heart failure with mildly reduced and preserved ejection fraction with age 18 or more. And NYHA class 2 and 3. And the patients need to be stable with a dose of heart failure medications for 4 weeks. And we include the patients with gait problem, worsening heart failure, recent angina or open heart surgery, end-stage renal disease, post-heart transplantation, anemia, moderate to severe valvular disease, significant primary pulmonary disease, and comorbidities with life expectancy less than 1 year. And some withdrawal criteria are as presented in the slide. To ensure the randomness and blindness, we use block randomization method with a block of 4 and 6 in a 1-by-1 ratio into two groups. The cardiologists Outcome measurement and data analysis researchers are blinded to the patient's allocation group, and all the participants are blinded to others' intervention. The intervention protocol. Firstly, high-intensity inspired muscle training will be performed with warm-up in 5 minutes, and the training resistance will be set at 30% of MIP in the first week, 50% MIP in the second week, 70% MIP from the third week. And the cooldown will be performed in 5 minutes. The sham IMT warm-up and cooldown will be performed similar to high-intensity inspired muscle training, and the training resistance will be kept at 15% of MIP in all the period of intervention. This the inspired muscle training device will be used in this study. We will use a pressure threshold device. It includes 11 adjustable levels of resistance corresponding to the resistance from 17 to 98 centimeter water. The study endpoints. My primary study endpoint is the change in peak oxygen consumption at 8 weeks, and the secondary endpoint is the change at 8 weeks of maximal inspiratory pressure, 6-minute walking distance, quality of life, diastolic function, and experience of some adverse events. I propose some ways to manage patients' compliance, include logbook, a phone calls every week, and a checklist. This data collection timeline from the admission to the end of the intervention. All this data will be collected during the first meeting when patients are eligible for the study. Additionally, they will be taught the training program prior to the study to ensure that the intensity will be maintained at the target level. Patients will undergo reassessment of maximal inspiratory pressure at the beginning of the second, third, and fifth week in order to adjust the training resistance. All the outcomes will be collected again at the end of the study. For the sample size calculation, we set the power of the study at 90% and the alpha level at 0.005. The results show that we need 12 participants per group and 24 persons for 2 groups. We're assuming that 15% of patients will drop out of the study. So the total participants is 29. The statistical analysis, intention to treat analysis will be considered. The normality of the data is examined by Shapiro-Wilk test. And the statistical significance level is p-value less than 0.05. The table shows the outcomes and statistic tests I use for each. Independent t-test and chi-square test will be used depends on types of data. Some problems with compliance would arise, but we use weekly phone calls and diary to alleviate the limitation. I intended to apply for the 90th anniversary of Chulalongkorn University scholarship to serve my study. The ethical issues. Cardiac rehabilitation is not implemented as a mandatory routine in King Chulalongkorn Memorial Hospital. So, comparing a high-intensity IMT program with some controls allows for a fair comparison to the usual care, while ensuring a non-biased and blinded study design. We also provide consent forms and opportunity to ask any question. And participants can withdraw from the research at any time. This is my study timeline, and I'm in the first stage. Thank you very much for your attention. I look forward to receiving your suggestions to help improve my thesis. Thank you very much.